Something that a lot of women have talked to me about during pregnancy that they're concerned about is pain. And that pain that they know is going to happen during labor and delivery. You know, labor is called labor for a reason. So having a baby does involve some discomfort and some pain at times, even if you have a vaginal delivery or a C-section. But women who are in recovery, especially for opioid use disorder or taking medications like Suboxone, Methadone, they have a lot of extra concerns they've told me about. Am I going to be able to get pain medication if I need it? Is the epidural going to work if I'm on Suboxone? If I'm taking Suboxone, do pain medications, even if I get them, are they even going to work? And is my pain going to be treated after I have my baby? These are all really good questions to ask your doctors and your nurses before you deliver your baby, but we're hoping to talk a little bit about that today. The first thing to know is that when you come to labor and delivery to have your baby, a lot of women do decide to have epidurals. Epidural is a type of pain medication that you can get in your back. And what's really good to know is that if you're on Suboxone or Methadone, your epidural is going to work just as well, even if you're not on that medication.
Yeah. A lot of women worry that an epidural is unsafe or causes back problems. Any back soreness that you might have afterwards is due to the labor process and delivery of the baby itself rather than the epidural.
Sometimes some women have had bad experiences in the past with their epidurals. It didn't work well, or they had issues with it, maybe in a prior pregnancy. Sometimes that does happen. Everyone's back is a little bit different, your bones and such. Sometimes the epidurals aren't perfect, but we can tell you that if you're taking medication for opioid use disorder, like Suboxone or Methadone, your epidural is going to work just as well, even if you weren't taking that medication. And so it's important to remember that if you are taking one of those medications, that you do continue taking that every single day. Don't miss a dose of it, even the day you're starting to go into labor, okay? Or you're feeling those contractions, or even the day if you have a scheduled C-section that you're coming in to have your baby via C-section, still take your Suboxone or Methadone that day. It might seem a little different. Why would I take this medication if I'm gonna end up having pain, right? Won't that get in the way of my pain medications? But that's actually not true. If you miss a dose of your medication, you can feel sick, and that can actually make your pain worse. And we definitely don't want that.
If you have a vaginal delivery, there's multiple things that you can do afterwards to help with the discomfort, because it is going to be uncomfortable. You've just given birth. There might be some swelling down below. You might have some stitches and so forth. Some women are even concerned just about, using the restroom after, giving birth. In the hospital, the nurses will be able to provide you with a couple of things that you can do that don't even involve medications. Some of those are, there's like a little squirt bottle. They give it a fancy name. They call it a peri bottle. But, you're filling this up, and it does really help when you are urinating to, squirt down that area, kind of relieve some of the stinging, burning, pain, also swelling as well. And I always tell people, hang on to that bottle and have it at home, because you're probably going to want to use that when you're at home as well. It's also very, it helps with cleansing. There's some little Tux pads is what they call them that they use. It's just little circles of kind of gauze looking pads, and they're saturated in a solution. But those are very helpful after giving birth. And that would be the norm for the pain relief after having a vaginal delivery.
And a lot of women ask me questions about if they have a C-section. So we just heard about how when you have a vaginal delivery, you won't need medications like oxycodone or other types of opioids for pain control. And that's for all women, even women, including women on Suboxone or Methadone or in recovery, but all women who have a vaginal delivery. But if you have a C-section, sometimes that can be more painful because it is a surgery, and the recovery that you can have after that surgery can be a little bit more intense pain-wise.
If you have a cesarean birth or C-section, a lot of women will need the things that we give for pain control for vaginal deliveries, in addition to other medications for pain as well, because the recovery from this surgery is more intense. One of the things that your doctor may suggest for you is to keep your epidural in longer for several hours after the delivery. This can help with pain during that first day.
So what's good to know is that all the things that we just talked about that are used after a vaginal delivery, you can use a lot of those things after a C-section too. And that includes the Tylenol and ibuprofen, taking them every 4 to 6 hours around the clock, depending on how your doctor talks to you about that. But then in addition to that, sometimes women will need extra pain medication, and that may be medications like Percocet, oxycodone, hydrocodone, Norco, things that do have opioids in it. And some women who are in recovery for opioid use disorder are concerned about taking that medication afterwards. Some of the concerns people have come to us with are these medications even going to work if I'm taking my methadone or my Suboxone medication? And I'm scared about taking these medications home for my recovery. I had a problem with those pills in the past. I don't want to go down the wrong road this time. And those are really good things to talk to your team and talk to your substance use disorder treatment team and also your OBGYN team about before you have the baby. Things that we talk to our patients about after they have a C-section is that you may need those opioid medications, and that is okay. If you need those pain medications for your pain control, that is completely okay, and that you can continue to take your methadone or your Suboxone, and we can still give you those pain medications on top of it, and they will be effective. You may need a little bit different dose than someone else who's not on medications like methadone or Suboxone. You might need to take the medication a little bit more frequently than someone who's not on those medications. So you do need to talk to your doctors and nurses about your pain regimen after you have a C-section and tell them if it's working or not. And just tell us so we can kind of tweak and we can work with you to see what the right regimen for your medications is for you and for your pain control. But again, number one, don't ever miss a dose of your Suboxone or methadone, because if you miss a dose, that can make it tricky of how we're going to make sure your pain medications work best for you. It's easiest if you just continue your addiction medications and then also talk to us about your pain medications and see what we can do to help you manage that pain after you have your baby. It's not going to completely go away.
Right. It's not a pain-free process.
No.
But we do want to make sure that you're comfortable enough to take care of yourself and to take care of your baby.
Mm-hmm. And the other thing to know is that if you have a C-section, some women, not all of them, but some women will also need pain medications sent home with them. So they might need to have a prescription for the Percocet or oxycodone and to go home with them, along with their medications like their Suboxone or going back to their methadone clinic. That's also okay too. But for some women in recovery, it's good also to know, what am I going to do when I go home to make sure that having these medications, these pain pills in my house, is not going to be something that's going to put my recovery at risk. And it's good to talk to us about that ahead of time. We want to help you make a plan to keep your recovery strong and safe after you go home after having a C-section. Common things our patients have told us that worked well for them is that they have a family member manage their medication. So they get that prescription and they give it over to a trusted family member, their sister, their partner, whoever it is that's helping you maybe take care of the baby too. Another thing is to keep those medications in a lockbox. So having that family member keep it somewhere where you just, for mental reasons, you know that you can't even get to it. And just having that peace of mind that it is not going to get anywhere in the way of your recovery helps a lot of women feel more comfortable taking those medications home.